Dear students, welcome back. In this session, we are going to discuss about spleen. It is the largest of the lymphoid organs, which is a red-brown in color, and it is a wedge-shaped organ, which mainly situated in the left hypochondrium. Left hypochondrium, and which is opposite to the levels of 9th, 10th and 11th ribs. If you see the long axis of the spleen, which corresponds to the long axis of the 10th rib. Okay. And if you see the shape and size, it is a ovoid and flattened anteroposteriorly, and it is having two ends, medial and lateral ends, and it is having two borders, upper border as well as the lower border, and two surfaces, anterior surface and the posterior surface. It is 2.5 centimeters in thickness, 7.5 centimeters in breadth and 12.5 centimeters in length. Okay, and if you see the weight, it is about 7 ounces in weight. Okay, yes, this is about the external features of the spleen. Okay, now we will see the relations of the spleen. Okay, the spleen is having before that we have to discuss about the hilum of the spleen. Hilum lies between the superior and intermediate borders, okay, and it pierces by branches and tributaries of splenic vessels. Now we will see the relations. One is the peritoneal relations. This includes the peritoneal relations, and next one is the visceral relations, and next one is the diaphragmatic relations. So first we will see the peritoneal relations. The spleen is surrounded by peritoneum, and it is suspended by some of the ligaments. One is the gastrosclenic ligament. This is the gastrosclenic ligament. This ligament extends from the hilum. So here you can find hilum of the spleen to the greater curvature of the stomach. Greater curvature of the stomach. It contains a short gastric vessels and associated with lymphatics and sympathetic nerves. Next one is the Lino renal ligament. Okay, this also extends from the hilum of the spleen, okay, hilum of the spleen to the anterior surface of the left kidney, to the anterior surface of the left kidney. It also contains the tail of the pancreas, the splenic vessels and associated pancreatico-splenic lymph nodes, lymphatics and sympathetic nerves. So this is the ligament, lino-renal ligament. Okay, so normally the peritoneum is suspended by these ligaments. Okay, another ligament is also related to this spleen, that is called as Phrenicalic ligament. So this ligament is not attached to the spleen but supports the anterior end of the spleen. It is a horizontal fold of peritoneum extending from the splenic flexure of the colon to the diaphragm. Okay, here you can see this is the splenic flexure of colon to the diaphragm. So these are all the peritoneal relations and the peritoneal ligaments. Okay, now we'll see the visceral relations. So the visceral surface of the spleen is related to the fundus of the stomach. Okay, and anterior surface of the anterior surface of the left kidney, and also the splenic flexure, okay, and also the tail of the pancreas. These are all the structures which are related to the visceral surface. First one is the fundus of the stomach, anterior surface of the left kidney, this is left kidney, anterior surface of the left kidney, splenic flexure and tail of the pancreas. Okay, and next we'll see the diaphragmatic surface. The diaphragmatic surface is related to the diaphragm, which separates the spleen from the costodiaphragmatic recesses. Recesses of pleura, lung, and 9th, 10th and 11th ribs on the left side. 9th, 10th and 11th ribs of the left side. This is about the relations. So if you see the arterial supply here itself, we can see this is mainly, spleen is mainly supplied by the splenic artery, which is the largest branch of the celiac trunk. This artery is tortuous in its course to allow for movements of the spleen. Okay. And this one passes, the splenic artery passes in the Lino renal ligament to reach the hilum of the spleen, where it divides into 5 branches or more branches. These branches enter the spleen to supply it. This is about the arterial supply. Now we will see the venous drainage. The venous drainage is mainly done by the splenic vein. Okay, the splenic vein is formed at the hilum of the spleen. It runs straight course behind the pancreas, and it joins the superior mesenteric vein. Behind the neck of the pancreas to form the portal vein. Okay, its tributaries are short gastric, left epiploic, pancreatic and inferior mesenteric artery veins. Okay, so these are all the tributaries of this splenic vein. If you see the lymphatic drainage, there is no lymphatics proper. The splenic tissue proper has no lymphatics. A few lymphatics arise from the connective tissue of the capsule and trabeculae and drain into the same pancreatico-splenic lymph nodes, which is situated along the splenic artery. Nerve supply is mainly by the sympathetic fibers, which are arised from celiac plexus, and they are vasomotor in nature. They also supply some smooth muscles present in the capsule. So these are all about the spleen, and the spleen has some of the important function, which is having a phagocytic action, and also it is a very important hemopoietic organ, and it shows some immune responses, and it helps in the storage of RBCs. These are all about the spleen. Thank you.